Welcome to the deep dive. We're going deep into psychotropic meds today. You know, how they work, what they're used for, things like that.
Really interesting stuff.
Yeah, you might be listening because of your job or just because you're curious about the brain and behavior. All good reasons to join us.
Absolutely.
We've got a whole bunch of sources. We're looking at textbooks, history, even some like medication guides, you know, like the pamphlets you get.
A real mix.
Yeah, the whole shebang. So let's start with a little time travel. Imagine mental health treatment before the 1950s. It's pretty bare bones, right?
Limited options back then.
Basically, you had sedatives and amphetamines. That was about it for psych meds. Can you believe that?
Kind of amazing when you think about all the medications we have now.
It's mind-blowing how far we've come.
Yeah.
Right? Like the 1950s hits and research just explodes. Bam, all these new classes of psych meds appear.
It's like a whole new world opened up.
Totally. But to really grasp how these meds work, we gotta get into brain chemistry, you know? Neurotransmitters, receptors, all that jazz.
It's all about those tiny messengers zipping around in your brain. They're called neurotransmitters, and they're constantly sending signals.
Okay, so like our brain's own little postal service.
Exactly.
Right.
And those signals need a place to land, right? That's where receptors come in. They're like mailboxes designed for specific neurotransmitters.
Got it. So how do medications fit into this whole messaging system?
That's the cool part. Some medications, called agonists, act like a letter being delivered to the mailbox. They enhance that specific message.
So they kind of boost the signal.
Exactly. Then we have antagonists, which are more like someone blocking the mailbox. The message can't get through.
So it's like they're either amplifying or blocking the brain signals.
You got it. And by understanding this whole agonist-antagonist thing, you can start to see how a lot of these psych meds work.
Makes sense. So let's dive into some of these medications. We hear a lot about anti-anxiety meds, also called anxiolytics. Think of them like emergency brakes for anxiety, calming things down fast.
A good analogy for sure. A major player in this category is benzodiazepines. You might have heard of alprazolam, also known as Xanax, or lorazepam, which is Ativan.
Yeah, I've heard of those. They work pretty quickly, right?
Exactly. They provide relief relatively fast. But there's a catch, you know. They can be habit-forming.
Right, I've heard that too. Can you elaborate on that?
Well, tolerance is a big thing. With benzodiazepines, you might need higher doses over time to get the same effect. And if you stop abruptly, you can get some pretty nasty withdrawal symptoms. So, yeah, caution is key.
So what about folks who can't handle benzodiazepines or who are worried about getting dependent? What are their options?
There's a medication called buspirone or Busbar. It works differently and doesn't have that same addictive potential as benzodiazepines.
Interesting. So is there a downside to buspirone?
It does take a bit longer to kick in, so not ideal if you need immediate relief from anxiety.
Got it. So it's more of a long game type of medication. And speaking of things to avoid, our sources really stress that alcohol and certain meds are a no-no with anxiolytics.
Mixing them can be dangerous. You're basically amplifying the sedative effects.
Good to know. So a balanced approach is key when using these medications. Now, let's talk about antidepressants. They work more gradually, right? Not like instant mood boosters.
You got it. Antidepressants are all about rebalancing brain chemistry over time. They're not a quick fix.
Okay, and there are a bunch of different types, right?
Yep. We have TCAs, SSRIs, SNRIs, MAOIs, and atypicals. Lots of options, like a whole alphabet soup of medications.
I've definitely heard of some of those, like Prozac and Zoloft. They're SSRIs, right?
Exactly. Fluoxetine or Prozac, and sertraline, which is Zoloft. Those are both SSRIs. And they're among the most commonly prescribed antidepressants today. They tend to have fewer side effects compared to some of the older antidepressants.
That makes sense. But like all meds, they still have side effects, right?
Of course, dry mouth, changes in libido, potential weight fluctuations. Those are some common ones with antidepressants. And there's still a risk of serotonin syndrome, even with SSRIs.
Serotonin syndrome. That sounds a little scary. What exactly is that?
Basically, it's when you have too much serotonin building up in your brain. It can happen if you combine certain medications or supplements with antidepressants. So it's super important to be upfront with your doctor about everything you're taking.
Yeah, all those interactions can get really complicated. It's like a delicate balancing act. So we've talked about meds that act like emergency brakes for anxiety, meds that slowly rebalance brain chemistry for depression, and now we're moving on to mood stabilizers.
The keel steadiers of the medication world.
I like that analogy. So mood stabilizers are for people with bipolar disorder, right? They help manage those intense highs and lows.
Exactly. They help smooth things out. Lithium is one of the classic mood stabilizers. It's been used for ages and is known to be pretty effective for bipolar disorder.
It has a pretty interesting history, too, right?
Oh, for sure.
Ah,
It was originally used to treat gout. Its mood-stabilizing effects were actually discovered by accident.
so a happy accident.
You could say that. But lithium does have a bit of a reputation for being tricky to manage.
Yeah, why is that? What makes it so challenging?
Well, things like dehydration, even just changes in your diet, can mess with lithium levels in your body. And it's a narrow therapeutic window, meaning even small changes in those levels can cause problems.
So consistency is key.
Absolutely. Staying hydrated, eating regularly, and taking your meds exactly as prescribed are super important for folks on lithium.
Sounds like it takes commitment.
Yeah.
What about people who can't tolerate lithium or have concerns about it? Are there other options for mood stabilization?
Yes. We've also got anticonvulsants. They were initially developed for epilepsy, but some of them also have these mood-stabilizing properties.
Interesting. So they're like multitaskers in the world of meds.
Exactly.
Yeah.
Valproic acid, also known as Depakote, and lamotrigine, which you might know as Lamictal, are good examples. They're often prescribed for bipolar disorder as well.
Okay, so we've got lithium, the classic mood stabilizer, and we have these anticonvulsants that can also help. Now, what about antipsychotics? I know those are used for conditions like schizophrenia.
That's right. Antipsychotics are a powerful group of medications, and we've got two main types: first generation, or typical antipsychotics, and second generation, or atypical antipsychotics.
Right. We talked a little bit about extrapyramidal symptoms, or EPS, earlier. What's the main difference between the two types in terms of side effects?
Well, typical antipsychotics are more likely to cause those movement-related side effects, like tremors and muscle stiffness. Atypical antipsychotics generally have a lower risk of EPS, but they often come with metabolic side effects instead.
Another trade-off situation, huh?
Pretty much. Finding the right balance between benefits and risks is always the goal in psychopharmacology.
This is all so fascinating, and we've still got a lot more to cover.
We're just getting started. Stay tuned.
Welcome back to the deep dive. We're picking up where we left off, exploring all these different psych meds. We were talking about antipsychotics, and I'm kind of curious about the specifics, like individual meds and their quirks.
Sure, let's zoom in a bit. One of the first-generation antipsychotics is chlorpromazine.
Yeah.
It goes by the brand name Thorazine. It's been around forever, used for schizophrenia and other psychotic disorders.
I've heard that name, Thorazine, one of the older ones, right. And you were saying this type has a higher risk of movement problems.
Yeah, that's the thing with those first-generation antipsychotics. They can cause tremors, muscle stiffness, all sorts of movement-related side effects. Plus, Thorazine itself can cause dry mouth, constipation, blurry vision, even lower the seizure threshold, so you got to be careful with folks who have a history of seizures.
Wow, a lot to keep in mind. Are there any really serious side effects to worry about?
There's one called neuroleptic malignant syndrome, or NMS. It's rare, but it can be life-threatening. And it can happen with any antipsychotic, but it's more common with the first-generation types.
That sounds pretty intense. What should someone look out for, and what do they do if they think they have it?
High fever, rigid muscles, mental status changes, and their blood pressure and heart rate can go haywire. It's a medical emergency, so call 911, get to the ER ASAP.
It's a good reminder that these medications, while helpful, are serious business. So, switching gears to second-generation antipsychotics, you said they have a lower risk of those movement side effects.
They do, but they come with their own set of potential problems, mainly metabolic ones. We're talking weight gain, insulin resistance, higher risk of type 2 diabetes, high blood pressure, stuff like that.
So it's like picking your poison, huh? Different risks to weigh.
Exactly.
Yeah.
There's no magic bullet in psychopharmacology. It's all about finding what works best for each individual, balancing the good with the bad.
That makes sense. Are there any specific meds in this category that are worth talking about?
Oh, definitely clozapine, also known as Clozaril, is a big one. It's super effective, often used when other antipsychotics haven't worked for schizophrenia.
I think I've heard of Clozaril. Doesn't it have a pretty serious warning attached to it?
It does. There's a risk of a granulocytosis, which is a big drop in white blood cells. It can be life-threatening, so regular blood tests are a must for anyone on Clozaril.
Okay, so that one needs close monitoring. What are the red flags to watch out for with a granulocytosis?
Fever, sore throat, mouth sores, those are the big ones. If you're on Clozaril and you get any of those, call your doctor right away.
It's amazing how much goes into keeping people safe on these medications. So Clozaril is powerful but needs those blood checks. What about other commonly used second-generation antipsychotics?
Risperidone, or Risperdal, is another popular one, used for schizophrenia, bipolar disorder, even irritability and autism spectrum disorder.
Wow, so it's kind of a multi-purpose med. Are there any side effects unique to risperidone?
One that comes up, especially in men, is gynecomastia.
Gynecomastia. I'm not familiar with that one. What is it?
It's when men develop breast tissue. Can be pretty distressing, even if it's not life-threatening. Just goes to show you got to think about all the potential side effects, even the ones that aren't super dangerous. Quality of life matters too.
It's all connected, isn't it? Okay, let's switch gears again. Now we're on to sedative hypnotics, the sleep meds, right?
Yep, those are the ones prescribed for insomnia, usually short-term.
What are some of the names we might recognize in that category?
Zolpidem, or Ambien, is probably the most well-known. Works by boosting GABA in the brain, which helps you relax and fall asleep.
Yeah, Ambien's a big one, but I've also heard it can be habit-forming. True or false?
Definitely true. Like a lot of meds that work in the brain, Ambien can lead to dependence, and you can get side effects like feeling drowsy or dizzy during the day, too.
Not ideal. Anything else to watch out for with Ambien?
There have been some reports of people doing some pretty strange things while sleepwalking after taking it.
Sleepwalking? Like what kind of strange things?
I'm talking driving, cooking, even having whole conversations while technically asleep. It's wild.
That's both fascinating and kind of scary. You definitely don't want to be sleep driving. It's another reminder to use these meds carefully under a doctor's supervision. So we've covered anxiety, depression, bipolar, sleep problems. What about ADHD? Are there meds specifically for that?
Absolutely. ADHD agents are a whole category of medications, and they're a game changer for a lot of people struggling with attention and hyperactivity.
What are the different types? I know there's a lot of talk about stimulants.
You're right. Stimulants are a common choice. They increase dopamine and norepinephrine in the brain. Those are neurotransmitters that help with focus, attention, impulse control. The big names are methylphenidate, or Ritalin, and amphetamine dextroamphetamine, which is Adderall.
So they basically rev up the brain chemicals that help you concentrate. Makes sense. But there are downsides, right?
For sure, stimulants can cause decreased appetite, trouble sleeping, anxiety, and there's always the concern about misuse and addiction.
Seems like it's a tightrope walk, finding the right balance, like with a lot of these meds. What about people who can't handle stimulants or who are worried about getting hooked? What are the alternatives?
We have non-stimulant options. One is atomoxetine, also called Strattera, works differently than stimulants, mainly affecting norepinephrine.
So it targets a different brain chemical.
Exactly. It might take a little longer to work than stimulants, but generally fewer side effects and less potential for abuse.
That's good to know. Any other non-stimulant options worth mentioning?
There's guanfacine, goes by brand name Intuniv. It's an alpha-2 adrenergic agonist, meaning it works on certain receptors in the brain to calm down hyperactivity and improve attention.
So a whole different way of tackling the problem.
Pretty much.
Yeah.
And like Strattera, it tends to have a milder side effect profile than stimulants.
It's amazing how many different approaches there are for managing ADHD. We've covered so much ground today. Anxiolytics, antidepressants, mood stabilizers, and now ADHD meds. It's like a whole universe of psychopharmacology.
We're just scratching the surface, really, but we've laid a good foundation.
I'm ready for more. Let's keep this deep dive going.
Welcome back to the deep dive. It's crazy how much we've learned about psych meds already, right? Like from those tiny brain messengers to all these different medication types.
It really shows you how complex mental health treatment can be, you know? There's always more to discover, too. Always new research coming out.
Totally. Before we wrap things up, I wanted to circle back to lithium. We talked about how it helps stabilize mood, but it can also be toxic, right? Like, what makes it so tricky? Lithium's kind of weird. It's a simple salt, but it has these powerful effects on the brain. But that simplicity also makes it hard to manage. You know, it's not processed by the liver like a lot of meds. Lithium's handled by the kidneys, just like sodium. So anything that messes with your fluid balance, like dehydration, even what you eat, can change lithium levels in your body.
So even little things can throw it off.
Exactly. And if those levels get too high, you can get lithium toxicity.
What are the signs of that? Like, how would someone know?
Early on, it can be sneaky. Stuff like nausea, vomiting, diarrhea, feeling super thirsty, peeing a lot, tired, slurred speech, weak muscles.
Sound like the flu, kinda? How can you tell the difference?
Good point. It's always safest to check with a doctor if you have any of those symptoms while you're taking lithium, just in case. If those lithium levels keep going up, things can get worse. You can get tremors, confusion, even seizures. In really bad cases, it can be fatal.
Yikes. So, close monitoring and talking to your doctor are super important for anyone on lithium. So we've talked about specific meds, but what about the bigger picture of mental health? Where do nurses fit in?
Nurses are essential, especially when it comes to these medications. They're the ones working directly with patients, giving them their meds, watching for side effects, teaching them about their treatment.
So they're like the link between all this complex science and the actual patient experience.
Exactly. Nurses are advocates for their patients. They explain how the meds work, what to expect, how to handle side effects. They're also there to listen to patients' concerns, make sure their voices are heard. It's a tough job, you know. You need to understand both the science and the human side of
It
things.
sounds like a delicate balance. What are some of the challenges nurses face in this field?
Stigma's a big one. A lot of people are hesitant to take psych meds, worried about what others might think, or scared of side effects. Nurses need to be sensitive to that, provide support and accurate information.
It's a good reminder that mental health treatment isn't just about popping pills. It's about trust, communication, and empowering patients to make their own choices about their care.
Couldn't agree more.
Well, this has been an incredible deep dive. We've gone from the history of these meds all the way to the role of nurses in mental health care. I feel like I have a much better grasp on this whole world now.
Glad to hear it. I hope our listeners feel more comfortable asking questions and speaking up about their mental health needs.
Absolutely. Knowledge is power, especially when it comes to something as important as mental health. The more we know, the better choices we can make about our own care.
Thanks for joining us on this journey into psychopharmacology. Keep learning, keep exploring. Until next time.
And remember, take care of your mental health. We'll catch you on the next deep dive.